Welcome to Community Conversations. I am Miss Ebony J, the Queen of Queens, and you are listening to 1230 The Buzz, your talk station on 101.5, 101.1 The Wiz, and 100.3 Cincy's R&B station. Community Conversations is where we come to talk about nonprofits and the great things that they're doing amongst the community to raise awareness and provide solutions. And so I'm so blessed to have, it's Sickle Cell Awareness Month. Last month we did so much and showed so much love to the women for Women History Month. This month we're focusing solely on sickle cell. And so I felt it was only right to bring in here with me Miss Annie Womack, the Executive Director of the Ohio Sickle Cell and Health Association. How are you today, beautiful?
I'm fine, thank you, Miss J. It's like J. All right, I like that.
Yes, ma'am. Ebony J. I want to ask you, for some people who may not be familiar, we hear all types of things about sickle cell, but can you tell us what it is and why it's so important for us to discuss this through our town hall meeting?
Well, sickle cell is a genetic blood disorder classified as a hemoglobinopathy, which only means blood disorders, but it is genetic, passed down through the genes and traits of families, predominantly in the African American community, but also in several other races and ethnicities throughout the United States of America and through the world.
So when we hear about sickle cell, a lot of people feel like it doesn't really impact them or affect them. I want you today to talk about the impact that sickle cell has on the community since the year of 2013.
Well, 2021. Well, I don't know what, well, okay, well, how it affects us now, how it's been affecting us, it's very important to understand that sickle cell hasn't gone anywhere. And so from hundreds of years ago when the first trait was identified, but previously to that, our brothers and sisters in Mediterranean countries, Africa, sub-Saharan Africa, the Mediterranean, all had the genes that cause sickle cell disease. But because they were in a tropic area, it was really a way to fight off malaria. But then when they came to the United States and those other climates where malaria was not prevalent, then those genes then caused and manifested itself in births of children that actually had sickle cell disease. So what we're doing now and what we've always been doing since the 60s, or how sickle cell has been around since the 60s, is educate people on their trait and hemoglobin status as it relates to sickle cell disease.
So what is the difference between the trait and the actual disease?
Trait is a gene, just like your eye color, your height, your hair color,
Okay.
what your body's made of. But the disease is when an abnormal sickle cell trait couples with any other abnormal hemoglobin trait, and then that manifests itself into disease. Trait is just a gene. Disease is actual disease, which is anemia or sickle cell disease, SSSC, or thalassemia, any other disease, and that's where you get the illness. But the other one is just a trait, which causes the illness.
So can you have the trait and not have the disease, or have the disease and not have the trait, or do they work hand in hand?
You can have the trait and carry the trait, and that's just a trait. So you can have trait all through your life and nothing ever happens. You don't have the pain crises and you don't get the ill effects of sickle cell disease. But sickle
Okay.
cell disease comes from two parents who both have a trait, an abnormal hemoglobin trait. They can have sickle S, sickle C, or the other numbers, and any other abnormal hemoglobin. Then they get married, they have a baby, and that baby then can have the disease.
Oh, wow. So do more people have the disease than the trait?
More people carry the trait.
Oh,
It's estimated that 1 in every 13 African American households, someone has the trait in those households. So if you line up 13 people, one of them gonna have the trait.
okay.
In African American households. In Hispanic households and other households, the prevalence may be lower, between 1 in 16 to 1 in 25. That data is still out there, those numbers. So you line up 25 people in different races, one of them will have the trait, either the sickle cell trait or any other hemoglobin trait. So any other blood disorder, they may have that. but the disease is up to what they estimate. The World Health Organization and CDC estimate that there is 100,000 people that have sickle cell disease. But if you go back to the 1 in 13, that's way more. That's billions of folks that
Right.
walking around with the trait or any other hemoglobin blood disorder.
Now I gotta be honest, like we mostly hear about, well, when I hear about sickle cell, I hear about it in the African American community. Does it affect only blacks, or can other them are other people fighting this fight?
Yes. So if you see the little chart behind me, you see the lady with the blonde hair.
Oh, that's why you
So
have that
this
there.
is called the faces of sickle cell.
Okay.
So Hispanics, Africans, Mediterranean, Greek, Jewish,
Okay.
African American, of course, but all those sub-Saharan Africa, Russian. So anybody who lived in a tropical climate that can have a sickle cell trait, a gene of some form of sickle cell disease. So this is the new face of sickle cell. It's not just African American.
I'm glad you clarified that one. Is sickle cell contagious, or is it something that is just only passed in the genes?
Yeah, it's only passed through your genes. So you can't catch sickle cell like the common cold. You can't catch it from anyone. It is genetic, just like some other things are passed down through families. I mean, you can't catch somebody's blue eyes, no matter how, brown. I mean, it's genetic. So somebody in your family pops up with green eyes, go down your family tree. Somebody got them. Somebody got them. So you can't catch. And now you do it with contacts now, but genetically you're born with it. So you have to be born. You're born with sickle cell disease.
Is there anything that parents can do to prevent it? I mean, that has to be extremely hard to know. Like, me and you produced this because it was something in us. Is there anything that they can do to stop it?
I mean, sickle cell, the way that it works with any genetic disorder, both of them have to have the trait. So what is very important is have education, because some people may say, well, I don't know. But if the two people don't have if there's not a sickle cell trait person in that relationship, they're fine.
Okay.
So if there's not one person in that partnership that has a sickle cell trait, they are fine. But if two people have a trait or any other type of trait, it's a 1 in 4 chance that out of every pregnancy that their child can be born, because it's just like the science project, X, Y, X, Z, and you put the two X's and the two Y's, and that's how done, but it's with S and no, and so you keep going, and that's how the person. And then with people with two, it's a 50% chance that out of every birth, your child could be born with sickle cell disease. So it's not every child. So if I have 4 children, me and my husband both have, or me and my partner husband both have the trait. Um, it's a 50% chance that our children will have sickle cell out of every birth. But it doesn't work like we got 4 kids. So that's not the
All
way it
four of
works.
them
It's,
to
it's
get it.
every birth. It's
Right.
every birth. I know families where all of their children have sickle cell disease. I know
Wow.
families where one child or two, but then some of them have a trait. So it's not, if you have 4 kids, you divide that in half, 50%. That's not the way it works. One
Okay.
thing for sure, if it's 2 people and they have children, all their children gonna have a trait. That's for sure. But the 1 in 4 comes out of every birth. So one of those children may have sickle cell. I know families with 3 children, one has sickle cell disease,
Okay.
the trait. But again, I know families where they have 4 children, all 4 of their children have sickle cell disease. So it's just the way in which the sperm meets the egg, and at that time, what is happening with that dominant gene.
Whoa, I have learned so much. So like I've had many interviews, but like this one really broke cell down to me a whole bunch more. Like you really helped me see so much. Now I know with COVID-19, everything about the world has changed. How has it really affected the sickle cell community?
Well, I think it more so has affected everybody else, because people with genetic blood disorders are used to cleaning, sanitation, because they can catch a cold, they can get sick, they can get a fever, they can get sick. Their bodies can be too hot, too cold, too warm. They can go out and get a common cold. It throws them into a crisis, so they're hospitalized. So we are natural, and I say we, people in the sickle cell community, are natural germaphobes. We've always had hand sanitizer. We've always, when they go to the doctor, they've always worn surgical masks. So they've always limited their contact. So what it has done, COVID-19 has allowed people who really didn't understand about genetic blood disorders or people with terminal illnesses like cancer, like lupus, like leukemia, like sickle cell, that now you can understand why a person says, I have to go to the doctor, I can't be around people for a certain amount of time, I have to stay secluded because I can't get sick, I can't get the flu, I can't catch a cold. So we're used to it. The sickle cell
Yeah.
community and other communities are used to it. What it's done is made people more sympathetic and empathetic to patients and parents when they say, my kids can't come out when it's too hot, or my kids can't play, they may get sick, or they may get a cold, or they may, lose shortness of breath, and into a crisis. So now people are understanding how, 40% of the population of the world who have pre-existing conditions are living.
Which is extremely hard, especially because the weather controls a lot of what their symptoms are.
Yeah, because if you get too hot, you get dehydrated. If you get too cold, I try to explain to people when I talk to different parts of groups of folk, you look at it like the oil in your car, or grease. When it's hot, it's liquid, it's flowing, you're good. But sometimes it get too hot and it boiling. So
Yeah.
imagine that. Then when the grease cools down, it starts to coagulate and gets clumpy. And that's how their cells are. They get stuck together and they can't. So you can't scoop that and pass it through. Then you got to warm it up a little bit. So that level of thinning it out, thickening it up, and that's kind of what it looks like, with a sickle cell patient on the inside. Because once it gets clumpy, it can't go through smoothly. Blood can't flow, so it gets stopped up and backed up. And so heat, cold, temperature, illness, all those things are factors.
This is Community Conversations on 1230 The Buzz, your talk station 101.5, 101.1 The Wiz, and 100.3 Cincy's R&B station. I am Miss Ebony J, here talking with Miss Annie Ross Womack, and she is the executive director of the Ohio Sickle Cell and Health Association. And we're just glad to have her here as we continue to raise awareness for sickle cell. It's Sickle Cell Awareness Month, and we want you to know that this is a disease that is affecting many people right here in our community. And so I want to ask you this, Queen. We talked about some of the symptoms, but can you tell us, how do we know if someone we're just walking past is affected by sickle cell, or are there other symptoms so we can know?
There are no outwardly symptoms. I mean, because I could have sickle cell, you wouldn't know it. It's not something that they wear on the outside. So there's no visible tell. I mean, I can tell if a patient has sickle cell by some different characteristics because I've been in this game for a while.
That's what I was about to say.
One
You
thing,
a vet in this business. Of
yeah,
course you
one
know.
thing, one thing about sickle cell patients is they don't age as much as we age because they don't have that blood flow. Because what sickle cell does, it deprives your body of oxygen. So every organ in your body, including the skin, is an organ, which is your biggest organ. So it needs air to live. It needs air to breathe. And so when you deprive organs, they don't grow. So a
Right.
lot of sickle patients are shorter, they're thinner, and they look younger because their skin has not been exposed to all that carbon and oxygen. So they look younger, which is, they like it. I mean, you can be talking to somebody who's 35, they look like they're 21. And you can talk to somebody and you're like, "Well, how old are you? You 16?" No, I'm 37. But that's one of the things. But the only way if they told you, because sickle cell is genetic, everybody's different. So there is no one pattern. Although we both may have SS or SC or thalassemia, we both may have the same disease, we're the same age, and we're same sex. But the way that your genetic makeup and my genetic makeup is different. So maybe I can function better, whereas you can't, or vice versa. Maybe I can hold down a job, but you have been sick and going through crises all your life. Maybe I have not had that. So it's genetic. So everybody's symptom is different, but the common symptoms are internal pain, because a sickle cell crisis or a blockage of that cell or in that vein can happen anywhere your body carries blood. So that's anywhere, behind the eyes, in the brain, the legs, because your blood goes everywhere. So you can get a pain crisis anywhere, behind the eyes, face, legs, fingers, toenails, anywhere body carries blood. you can have a pain crisis. So they explain it. So a lot of people that have sickle cell have told me to explain it as if, you get that Charlie horse, that cramp, that labor pain, those menstrual cycles all at once. Somebody hit, as men, somebody hit them and they jump. I mean, that's that intense pain. Imagine that all at once in one location in your body. And that is what the crippling pain. And because blood is being shut off and restricted, then that begins to lead to organ damage. And so their lungs, their kidneys, their spleen,
Oh.
all those things begin to die off. And so that's the internal pain that they're feeling.
Oh my goodness. So how do you treat this?
Well, sickle cell for many of the years has been treated with, of course, narcotics, painkillers. People take painkillers, and then we have hydroxyurea, which helps with the for a person. More like a penicillin, but it's a better version, so people won't get an infection in the blood or infection in their body, because you can't fight off an infection if you're always sick. So we have 3 other medications that have been approved. One is a oral medication that they take. It's like a regime. It's a glutamine, which adds more oxygen to the body.
Okay.
Glutamine is something that bodybuilders take. So if you ever notice bodybuilders, they can be pumped up for a month, for then you go down and like where the muscles go, and that's what that glutamine does, is provide the oxygen. So they've been using that for years. And then we have 2 other medications that are administered at the hospital. One kind of breaks down the clump or the blockage, if you will, as I explained it with the grease and how it thickens up
The
and breaks it
blood.
up. And then one is for definitely for the pain, to kind of widen the veins so that the blood can get through. And so those are the treatment, the medical treatments, because there is no universal cure for sickle cell, but other than a bone marrow transplant. And I say it's no universal because everybody can't get it, because it depends on your body, your genetic makeup, how many crises you've had. Is your body breaking down on the inside for organ and internal damage? Is it risky? Can you find a match? And so those are some of the things. So if everybody could do it, there'll be a universal cure. So that is the only cure, is a genetic bone marrow transplant, and then stem cell, which is the same thing.
Now, I realize everybody's not like a pill person or a medicine person. So you named off like 3 different medicines that a person can take. If they aren't able to take, pills and medicines like that, does that mean they forfeit trying to get some kind of treatment, or are there
One of
alternatives?
the medications is oral. It's a liquid. It's a powder.
Okay.
And and some at children's age, children have. So most of the children's medications are liquid. So it's
Okay.
like a liquid. So just like they do liquid Tylenol, liquid, the hydroxyurea comes in a liquid form for them to take. So that, because their body can't break down, they can't chew. So they have to have something. So, and then there's shots, and then there's oral. There's different oral. You can get it. There's some of the medications have come like in a chewable. I mean, as we advance in medication with vitamins, now you can get them in gummy bears and all this. So some of the things are chewable, so they can easily digest and break down.
Well, I guess my next question is because just listening about sickle cell. So it's something, our blood is all moving smoothly every day, but people that have sickle cell, their blood just stops. And it stops at a point where it forms all together in one place that causes pain. Am I understanding it correctly?
So
And then
yeah, what happens is, yeah, you do. And we can look at it this way as well. One of my other demonstrations is probably, you're driving down a 4-lane highway, and one lane gets stopped, you got to go down to a 2. And then imagine a big truck just
right,
cuts and blocks everything. So on the other side, all the cars are flowing good. They getting what they need, but then you got this massive backup. And as much as you push, that truck can't fit through that little artery. So
right,
that clump has to be broken up. And that's where the pain. So, and your veins are only so big.
right.
So they can't expand, and sometimes they rupture, which causes more pain, because then you have internal bleeding. So you have to think of it as that way. And then as you go through your body, veins in your organs are smaller than veins in your arm. So you got heart problems, and that's just what everybody call heart attacks. But cutting off the oxygen, the blood flow. In your brain, you can have a stroke by cutting off the oxygen, your blood flow behind your eyes. So these are all different things that happen. So that stoppage or that blockage or that traffic jam or that dull signal that's not getting through. And then, when I have presentations, we come in, the first thing we do, we give them the smallest rubber band we can find. We tell them to wrap it around this finger and see how long they can take it. So, and this begins to throb. The color goes out.
Correct.
Begins to get cold because it's dying off. And we have people take it. How long can you keep this on? Can keep it on through the whole presentation. Imagine that pain
Right.
all through your body. Because some people, you put the rubber band on your wrist too, and you look up and you start losing mobility. You start getting the tingling sensation. The
Yeah.
fingertips get cold. Then the pain. Then you begin to actually feel your heartbeat through your fingertips
I was
because
about
it's
to say,
cutting,
yes.
because the heart is trying to pump it and it's not getting in. So that's another way of explaining it as well.
What is the average life expectancy for someone dealing with sickle cell? Has that changed at all from COVID-19, or is it still about the same?
I think the average life expectancy has definitely changed for the better. It used to be 12. Then it moved
12
up
years old?
12 years old because they didn't have a lot of things, and a lot of children would die very early because of internal organ damage not being treated. Then that moved up to definitely 20s, in the early 20s, because of the influx of hydroxyurea, which was one of the only medications that we had for infections and things like that. So now we have people that, I mean, depending on where they are, we've had people that are living their 90. We've had people that are living,
Okay.
because though, depending on your lifestyle and again your genetic makeup. I mean, you have people that have always walked and exercised. It's just like anything else. Having sickle cell does not exclude you from having any of these other pre-existing conditions. I mean, you can have sickle cell and
Right.
cancer, sickle cell and congestive heart failure, sickle cell and high blood pressure. So coupled with that, so it's still a lifestyle. So people can live just like with cancer and any other, it's no longer a death sentence. People can live long lives, depending on, how they take care of themselves, what do they induce in their body and their atmosphere. Sometimes you just got to pack it all up and move to a warmer climate. Sometimes you have to change the way you eat, diet, and exercise. So it's a lot of different things depending on one's genetic makeup.
Would you say you need a specific doctor for this kind of treatment?
Yeah, most sickle cells have hematologists, which are blood specialists, and they manage their sickle cell. But you still would need a primary care doctor because you still need to do everything else. Get your eyes checked. Do all your monthlies. Do your girl visits. Do your boy visits. I mean, do your man and woman visits. You still have to take care of the total package, and not just deal on that. And so that's kind of hand in hand. So that's a lot of things that our sickle cell patients are struggling with because they're always sick and they're always at the hospital with the hematologist. A lot of these other things fall to the wayside. Like everybody has dental insurance, but people walk around every day and they'll bite the pain, they won't go to the dentist. So
Correct.
those are some of yeah, and so it's just those type of things that it's a whole package. But a hematologist, and then they have internal medicine doctors because again, people with sickle cell have a lot of internal damage, so they do have doctors that specialize, in internal medicine, pain management doctors to help them with pain, so that they're not relying so much on the narcotics because those also break down your organs after long a period of use. And then we also, make sure that they are talking to counselors and social workers because, it's hard, when you're a teenager and you really start to understand what you're dealing with. And so you can feel like you've been handed a death sentence at an early age, but then somebody has to be there to walk you through that and talk you through that.
Yeah.
So we rely on that whole team, that whole comprehensive approach.
Well, before we get out of here, can you share with us the services that you all provide and maybe where we can go and learn more about sickle cell itself?
Yeah, we are a state agency that provides services to all 88 counties of Ohio. So, first of all, it's education. So, we make sure that everyone is educated from the person who has sickle cell disease and the people that don't know, sickle what, don't know what it is. Then, advocacy. So, we advocate for our population through legislation, at the hospitals, through all the systems, hospital system, financial system, school systems, every system is always a fight for people to understand what sickle cell is and why this person can't come to work. It's not that they're lazy; they are in crisis. So we educate, and then we make sure that people have, the financial support that they need through services. Unfortunately, we cover people from cradle to grave, and unfortunately, we have to pay for services because you do have people that have never worked a day in their life, where you've had another person who's worked all their life. There's a mass gap in education. Like right now during COVID, we're doing more education for people can understand, why your loved one don't want you at their house. Yeah, although you got the shot and although you have not tested positive, yeah, that's fine, but you still can't come to my house.
Yeah.
So we try to deal with all levels of education from professionals all the way down to just the general public to make sure that they understand. First of all, not going anywhere because people are still having children. So
Right.
that's what we do. And we do outreach. Before COVID, of course, we used to have health fairs and all of that. But, with COVID-19, we definitely had to switch the way that we've done outreach. A lot of it has been virtual. And just talking to people over the phone. But we used to have, fairs, walks, the big awareness activities. But again, once we go back to that, we'll start doing more of that. But right now we're focusing on our advocacy to making sure that our population, can get the shot, can get these, can get the dollars, can get COVID relief, can get the things that they need.
Yes. Thank you so much for coming on. I really appreciate it. The website is ohiosicklecell.org. Please make sure you go to the website, get more information, learn more. And you all are doing such amazing things over there. I mean, like I said, you just broke this thing down to me to a T, and I understand it so much better. So my heart goes out to my sickle cell warriors. Keep fighting because we love you and we appreciate, your battle. We know it's not your fault at all, and it's not a death sentence at all. There is still life, even with sickle cell. And so, thank you so much for coming on the Ohio Sickle Cell and Health Association, Miss Annie. We appreciate you so much.
Thank you for having me, and I appreciate the opportunity.
You all, if you would like to learn more, please visit ohiosicklecell.org. This is Community Conversations on 101.5, 1230 The Buzz, your talk station, 101.1 The Wiz, and 100.3 Cincy's R&B station. If you would like to be a guest, all you have to do is send me an email and you can come on by msebonyj at radio-1.com. See you next week. Perfect, Queen. So we're good. I have
Okay.
the video part. We're going to edit this thing up and get it ready for April. You'll air in the second week of April. You're going to kick off our sickle cell moment. If you have or know any other sickle cell resources, please send them my way because I'm having a hard time finding other sickle cell organizations, but I want to make the whole month about sickle cell. So if you have any other
Yeah, I can
organizations.
send you. I can email you all the organizations. We actually have 4 foundations in Cincinnati.
Okay, yes,
I
please
will
send
send
them
that to
to
you.
me
And
so I
then
can look them
we have
up.
a couple blood drives that I would love for you to talk about because although the blood supply is low, the need is still there.
Correct. And I know I've had Hawthorne a couple of times because they're having a hard time getting blood as well. So yes, please feel free to email me any more people. I'll be doing more interviews the week of April 3rd. So I would love to get some more people scheduled. So yes, if you send them by, I'll follow up with them all this week and
Okay.
get it scheduled up. I really appreciate what you're doing. If you ever need any more assistance or want to get some more information out, please don't hesitate to reach out to me. Okay, beautiful.
All right, darling. I appreciate you. Thank you so very much.
Okay, Queen.
Bye
Have a
bye.
great day. Bye.